Amlodipine is used alone or in combination with other medications to treat high blood pressure in adults and children 6 years and older. It is also used to treat certain types of angina, chest pain, and coronary artery disease, narrowing of the blood vessels that supply blood to the heart. Amlodipine is in a class of medications called calcium channel blockers. It lowers blood pressure by relaxing the blood vessels so the heart does not have to pump as hard. It controls chest pain by increasing the supply of blood to the heart. If taken regularly, amlodipine controls chest pain, but it does not stop chest pain once it starts. Your doctor may prescribe a different medication to take when you have chest pain. Indications: arterial hypertension, stable exertional angina, and vasospastic angina. How to take, course of administration and dosage. Inside once a day with the necessary amount of water. With arterial hypertension and angina pectoris, the initial dose is 5 mg, 1 time per day. In the absence of a therapeutic effect within 2 to 4 weeks, the dose of the drug can be increased to 10 mg per day once. In elderly patients, dose adjustment is not required. In patients with renal insufficiency, it is recommended to use amlodipine in usual doses. Contraindications: hypersensitivity to amlodipine, other dihydropyridine derivatives or other components of the drug, severe arterial hypertension, cardiogenic shock, acute myocardial infarction during the first 28 days, unstable angina, obstruction of the outflow tract of the left ventricle, clinically significant aortic stenosis, age up to 8 years, efficacy and safety has not been established. Special instructions: during the period of therapy with amlodipine, it is necessary to control body weight and sodium intake. The appointment of an appropriate diet is indicated. It is necessary to maintain oral hygiene and supervision by a dentist. To prevent painful bleeding and gingival hyperplasia. When stopping treatment with amlodipine, it is desirable to gradually reduce the dose of the drug. What side effects can this medication cause? Amlodipine may cause side effects. Tell your doctor if any of these symptoms are severe or do not go away. Swelling of the hands, feet, ankles, or lower legs. Headache, upper stomach, nausea, stomach pain, dizziness or lightheadedness, drowsiness, excessive tiredness, flushing. Some side effects can be serious. If you experience any of the symptoms, call your doctor immediately or get emergency medical treatment. More frequent or more severe chest pain, rapid, pounding, or irregular heartbeat, fainting.